السلام عليكم. الليلة هنتكلم عن cardiovascular system examination. Before we start the cardiovascular system examination, make sure that you make the privacy of the patient and the patient is comfort and the table in 45 degree and so on and in the right side of the patient. This is the first, okay? Then start by inspection. Inspect your patient. Inspection, general appearance of your patient well, unwell, distress and so on. Look for the hand for stigmata of infective endocarditis, finger clubbing, splinter hemorrhage and osler nodes and genuine lesion. Then you can check tobacco stain and tremor. Examining the pulse, look for rhythm before rate. Start rhythm, okay? Start the rhythm before rate. Rhythm occasionally regular, occasionally irregular, regular, irregular sinus rhythm. The rate could be bradycardia, tachycardia, and so on. Look for the volume, large volume, small volume, character of the pulse, which is not fully important as a student. Look for synchronicity, look for radiofemoral delay, or do it peripheral pulsation at the end. Then check the blood pressure. Come to the face, examination of the face, look for exanthelasma and cornea for aqueous nails and pillar and central cyanosis, Muller flush and fundoscopy by ophthalmoscope to look for other sign of infective endocarditis like rosy spot and looking for hypertensive retinopathy and diabetic retinopathy. Then come to the neck. In the neck you have to check for GVP, carotid pulsation. When you finish the GVP, you come to precardium. You want to see the precardium, the patient exposed. In inspection, you have chest deformity in form of pectus excavatum and carinatum, scars and visible pulsation and prominent vein. If you have prominent vein, you have to look for it. Then palpation. Start by apex speed. Apex speed could be normal apical impulse or displaced apex or impalpable or tapping or heaving. Or it could be double apical pulsation like in hypertrophic obstructive cardiomyopathy. Okay, left parasternal heave, second heart sound and thrill. You finish the palpation. Come to auscultation. Heart sound, first heart sound, second heart sound, if there is third heart sound or fourth heart sound. Added sound in form of open snaps in mitral stenosis or ejection, systolic click in early systole just after the S1. It does not occur if the valve is calcified. Mid systolic click and pericardial friction. All this is added sound. If it is present you have to look for it. نفتشها يعني. تمام. في الميرمر عندنا حاجات معينة هنشوفها. التايمينج بتاع الميرمر والكاركتر بتاعت الميرمر والبيتش والintensity of the murmur, location and radiation. And if this murmur affected by respiration or this murmur affected by postures. Okay. You have to mention it all, okay? Then after you finish the auscultation for lung pieces, for cracker, pulmonary edema, examination of the abdomen for hepatomegaly and ascites, lower limb and sacral edema. Then you have to make summary for your examination, and this is the end of cardiovascular examination. إلى أن نلتقيكم في حلقات قادمة. السلام عليكم.